My name is Blossom Brown. I'm 28 years old. I attend Mississippi University for Women here in Columbus, Mississippi. I am a public health education major. I'm a trans health advocate. I've been featured in a couple of campaigns. I've done a lot of volunteer work. I feel that we're underserved and misrepresented, and we need to help change that.
It's completely about society deciding who is deserving of healthcare and who isn't, and what is normal and what isn't. Because if you're assigned male at birth and you have low testosterone, then clearly we must help you fit into your role in society and give you more testosterone, and let's help him out with that. But if you were not assigned male at birth and you want to take testosterone, well, that's just weird and you're a freak, and we are not going to cover that, and you'll just have to deal with it. Trans healthcare is healthcare for trans people, and it's often the same sort of healthcare that other people are getting, but for different reasons.
Health generally is an LGBT equality issue, because if we want to be able to enjoy all of the rights and protections that we're fighting so hard for as a movement, we need health. But for transgender people, there's that extra step of so much of people's identities being bound up in whether they're able to be who they truly are, to look in the mirror every morning and recognize the face that's looking back.
I'm not insured. I do have to pay out of pocket despite me being a struggling college student. If there comes a time where I truly cannot afford my hormones, it will definitely do something to my physical, mental, and emotional state of well-being.
Trans people encounter discrimination in pretty much every area of their lives.
If your name doesn't match your social security card, if you're telling them you want to be called by one name, but all this documentation says another, and it costs money to change the documentation, but you don't have money because you don't have a job, and then they don't hire you because the documentation doesn't match. It's this vicious cycle where you can't get ahead in any way. You can't get a job, so you can't save money, so you can't get health care, so you can't do anything. And you just sort of live the best you can.
There are a number of states that have non-discrimination laws that are inclusive of gender identity, but still only about half of states actually have protections from discrimination on the basis of gender identity. So what is actually happening on the national level is there has been a bill that was introduced at the end of July called the Equality Act, which would add gender identity as well as sexual orientation to the protections of existing federal civil rights laws. And that will be nationwide in scope, and that will clarify that discrimination is not permitted against transgender people or against any member of the LGBT community. Health insurance in the United States is largely a for-profit industry, and the way that you make profit in health insurance coverage is actually by discriminating.
If you call them and ask, hey, I have a prescription for testosterone. Will you cover it? If you are a cis person, yes. If you are a trans person, no.
The Affordable Care Act has been around for more than 5 years, and there still are no regulations implementing Section 1557, which is the provision of the Affordable Care Act that explicitly includes these non-discrimination protections. The law is already in force, but as is the case with any law, clarity is really important for helping people understand what their rights are and helping quote-unquote covered entities, so those entities, insurance carriers, hospitals as examples, that are subject to the law, helping them understand what their responsibilities are. So the fact that there are no regulations implementing 1557 is a problem. There's not a lot of education as part of medical school or nursing school curricula right now about who transgender people are, how to work with a transgender person through gender transition, but then also just in terms of everyday healthcare.
Even well-meaning people don't actually have a lot of training. They don't know what trans people need. And sometimes even when they are very well-intentioned, they are scared. Again, not because they don't have the training. They don't know what we need.
It deals with healthcare that people are not quite familiar with, but it does exist, and they need to know that it exists.
It's already hard enough when you don't connect to your body well to convince yourself, okay, this is a part of my body that everyone in the world views as female, and I'm going to have to go to a doctor that everybody calls the lady parts doctor, and I'm going to have to deal with all of that, and they're going to be around that area. Bad enough for most trans people to have to deal with that. To then add to the fact that the doctor is basically treating you as a second class or even third class citizen makes it even harder.
Transgender people are constantly put in the position of being told that their bodies do not belong to them, that they are not able to get the healthcare services that they need. And that is really at the root, I think, of a lot of issues that people encounter with the healthcare system of not being able to get what they need because of this double standard of being told that some people's healthcare needs are more real than others.